How does cold exposure affect immunity and inflammation? In recent news, many people are curious about how cold exposure impacts our immune system and inflammation. With the changing seasons, this topic is especially relevant. As we head into colder months, understanding how our bodies respond to cold can help us maintain our health. So, how does cold exposure really affect immunity and inflammation? Cold exposure triggers the production of cold shock proteins in the body. These proteins appear within minutes when cells sense cold or other stress. They play important roles in protecting cells and calming inflammation. For example, the cold shock protein known as SIRP can either reduce or increase inflammation based on its location in the body. When cold exposure is brief and controlled, SIRP tends to work inside cells, soothing inflammation instead of fueling it. This suggests that short bursts of cold exposure may help moderate immune responses and decrease inflammation. Additionally, cold exposure causes blood vessels to constrict. This constriction can reduce swelling and help flush out waste products from muscle activity. This vascular response is particularly beneficial for managing inflammation after physical exertion. Furthermore, repeated cold exposure over time has been shown to increase white blood cell counts. White blood cells are essential components of the immune system that help fight infections. Practices such as contrast therapy, which alternates between heat and cold exposure, have also been linked to benefits for the immune system and inflammation control. This method may improve cardiovascular health, metabolism, and immune responses, supporting overall well-being. However, it is important to note that cold exposure can have complex effects depending on how long and how intensely it is applied. Excessive or prolonged cold exposure may disrupt certain physiological processes. For instance, in women, intense or long-term cold exposure can reduce blood flow to reproductive organs and potentially affect hormone regulation and menstrual cycles. This indicates that while moderate cold exposure can lower inflammation and support immune resistance, overexposure might lead to negative effects. Moderate and controlled cold exposure activates protective proteins that help calm inflammation and boost immune cell counts. This aids in recovery and immune defense. The constriction of blood vessels also helps reduce swelling and clear metabolic waste. Yet, the effects depend on how cold exposure is applied, with excessive exposure potentially causing hormonal and circulatory disruptions. Understanding these dynamics can help you make informed decisions about incorporating cold exposure into your health routine.